Hello guys, today we're going to talk about ovarian tumor. Ovarian tumors represent a proliferative process that can be benign, malignant, or borderline that occur in the ovary tissue. The growth is not directly related to hormonal dysfunction, which sometimes makes them more difficult to diagnose. The diagnosis approach involves first ruling out the possibility of a functional cyst, and secondly, confirming whether the tumor is benign or malignant. The ovary is a mixed gland composed of both surface epithelium and germ cells. These characteristics explain the diversity of tumor types that can develop within it. Benign tumors are the most common, representing about 90% of cases, especially in young women. However, ovarian cancer or ovarian carcinoma is the most serious among gynecological cancers. Its prognosis is often poor due to its asymptomatic nature during the early stages of development. Malignant tumors, although rarer, affect more postmenopausal women, typically over the age of 50. The diagnosis of these tumors is primarily guided by pelvic ultrasound. However, the confirmation of the tumor's nature can only be made after histological examination, which accurately determines whether the tumor is benign or malignant. There are numerous risk factors associated with the occurrence of ovarian tumors. First, certain reproductive factors lead to an accumulation of ovulation, which may promote the appearance of tumors. These include nulliparity, which is the absence of pregnancy throughout life. Another risk factor is late first pregnancy, which means having a pregnancy at an older age. Early menarche or early menstruations and late menopause, this prolonged ovulation period, thereby increasing the risk. The use of ovulation and using hormonal treatments and smoking and excessive body weight are also contributing factors to an increased risk. In addition to hormonal and behavioral factors, genetic factors also play a significant role. A family history or personal history of breast, ovarian, endometrial, or colon cancer are a risk factor. Furthermore, certain genetic mutations such as those in the BRCA1 and 2 genes or Lynch syndrome type 2 significantly increase the risk of developing malignant ovarian tumor. We will talk about clinical symptoms, positive diagnosis, and treatment for these tumors in the following videos. Thank you so much for watching till the end, and I'll see you in the next one.